Welcome viewers. Today we have brought a very important topics. We give in IV fluids in our hospital daily for different serious cases. We give IV fluids. But today in this video we have discussed what are the types of IV fluid, why they are given, how to give in details. So, viewers, it's a very important topic. You must see it throughout the video. And I am Dr. J.P. Das, Director of Mousumi Hospital and Principal of National Institute of Medical Science. Without killing time, we are starting the video. IV fluids are specially formulated liquids that are injected into the vein to prevent or for the treatment of dehydration. They are used in people of all ages who are sick, injured, and dehydrated. Why we are using intravenous fluids? Now we are going to explain. Water is essential to every cell of our body. In fact, our bodies are made up of 60% of water. When you do not have enough water in your body, that's called dehydration. A person needs IV fluid when they become dangerously dehydrated. Serious dehydration may occur when you are sick or you are having vomiting and diarrhea, or by exercise, too much time if you spend in heat without drinking enough water like in desert. When you will have an injury of burns, there may be dehydration. When you will have surgery, especially when you are asleep for a long time and unable to eat or drink, you may get dehydration. Now, we shall describe what are the effects of dehydration. When you are dehydrated, it can affect the balance of important minerals, that is, electrolytes, in the body. Now, your cognitive performance, that is, mental performance, may be hampered. Your energy level will go down. Gastrointestinal function, that is, your ability to digest food or create pee and pop, will become hampered. There will be headache frequently and intensity. Many organs, including kidney and heart and brain, would be affected. Physical performance would be affected. Your skin health will go down. Now, what are the signs of dehydration? You may have dizziness. Your eyes may become dry and there will be no tear from your eyes. There will be dry lip and tongue, dry, wrinkly or blotchy skin. There will be fatigue. You will feel tired. There will be fast breathing, hands and feet that are cool to touch or blotchy looking, less pee than usual. It may be fewer than 4 times per day. And pee would be dark yellow and smell strong. Now, we come to the procedure details and what are the types of IV fluids. There are different kinds of IV fluids. Your healthcare provider will decide which type of right IV fluid is for you, depending on why you need them. First, we shall see the colloid solutions. These are the most common types of IV fluids. They contain small, dissolved molecules that pass easily from bloodstream into the tissue and cells. Example includes normal saline, water, salt in water, 5% dextrose water, which are dextrose in water. Another example is lactated ringers, which contains sodium chloride, potassium, calcium, and lactate. It's used for aggressive fluid replacement. Colloids, these are large molecules that cannot easily pass through the cell membranes, are more likely to stay in blood vessels. Example includes albumin and starch. What happens during rehydration with IV fluids? Now we shall see what will happen during the rehydration with the IV fluid. If you need IV fluid, a healthcare provider will decide the type of IV fluid you need, determines the amount of fluid you need and how quickly. This is based on many factors, including your weight, age, and medical condition. Disinfect, that is, cleaning the skin where IV will go, usually on inside the elbow or on the top of hand. Tie a elastic band, which is called tunicates, around your arm to make your blood fill the veins. Examine the veins to find the exact insertion site. Slide a sterile needle into the vein, which may pinch. The needle will have a small plastic tube at the other end. Place a small plastic attachment into the tube. Test the tube to make sure a little bit of fluid can go in. Tape the IV needle to your arm so that they stay in space. Attach the small tube to a longer tube, then attach it to the bag. Hang the bag from a hook on a tall stand, which is called IV stand. Turn on machine that will pump the fluid into the IV line. Check your IV line regularly and monitor the amount of fluid entering your body. The IV also may be used to deliver medication and nutrition. IV fluid can make you feel better very quickly, but your healthcare provider will determine when you can stop receiving intravenous fluid. Now we come to the risks and advantages of IV fluid first, and then the risks. If IV rehydration is a common, simple, and safe procedure that can make you feel better quickly, help save your life, you are seriously healed. But rare complications can occur, including air embolism. An air embolism or gas embolism occurs when an IV pushes too much air into the vein. It is rare but can have serious consequences, including possible death. Sometimes the vein collapsed when the needle is inserted or when an IV is placed for a long period of time. If this happens, your healthcare provider will try to find another vein to use. There are many other veins to take over the collapsed vein. It is too much fluid. If given too quickly, you can experience a headache, high blood pressure, and trouble breathing. This is usually resolved quickly with an adjustment of fluid level, but it can be dangerous. A hematoma occurs when the blood leaks from the blood vessel into the nearby tissues. It looks like a bad bruise and usually goes away a few weeks. If they are not clean when the needle is inserted, infection may occur. Your healthcare provider can usually treat infection with an antibiotic. If the needle moves or gets dislodged, fluid can enter the tissues around the vein. This may cause stinging and bruising, but it's typically easy to resolve. Phlebitis occurs when the vein becomes swollen because of IV. It's one of the more common complications, but usually easily treatable by removing the IV, applying a warm compress, and elevating the arm. Friends, we have come in the end of this video. Hope you have liked the video, and thank you very much for seeing the video. If you liked the video, please give a like, and if you are new in this channel, please subscribe the channel such that I can bring new informative such video in future very soon. Hope to see you in the next video. Until then, bye bye.